Welcome back, everybody. It's World Coronavirus Virtual Conference. We're bringing experts around the world to talk about what is going on right now and where we're heading. So right now, I have a privilege to introduce you Rhiannon Eley. She's a founder and CEO of Learn, Share, Care. Definitely, she's going to talk about that initiative in a while, and also. I want to give a little pretext about what the Learn, Share, Care is. It's a global classroom which provides e-learning and continuing professional development for nurses and midwives in the low resource settings. She used to teach in Florence Nightingale School of Nursing at King's College and now based in University College of London. Is it right?
Yeah, that's correct.
So we are happy to have you here, Rhiannon.
Hi, thank you so much for having me.
Excellent. So you are a nurse yourself. So today,
that's right.
So today we had two people. So let's say who are combating, who are the soldiers in the forefront of fight against COVID-19. So can you tell us a little bit more about what's going on right now and where are you? I think you're in London right now.
That's right. I am in London. Yes.
Yeah.
So we're living here in London in the epicenter of the UK. So we have more cases and more deaths than anywhere else in the UK. I'm working in one of the biggest hospitals here in London as well. So I've actually recently moved over to St. Thomas's Hospital, which I'm sure some of the people watching will know of. And yeah, we're seeing unprecedented demand for our critical care services in particular. And it's incredibly busy for our frontline staff. Not only are we seeing a massive increase in patients, but actually the way that we manage those patients, the treatments that they're having, and the requirements for personal protective equipment are impacting quite significantly on the way that we're able to care for our patients. So it's very, very busy and very difficult working conditions at the moment.
Yeah, and I would like to just take a moment and thank you for all your fight on behalf of everybody. I think it doesn't matter me, like from Uzbekistan, thinking nurse from UK. Right now, this virus is not knowing any borders, and our gratitude shouldn't know any borders. You are protecting lives. We are in the forefront. So, on behalf of us who are just sitting at home and watching cat memes, thank you very much for saving the lives, and thank you for doing all that battle.
Oh, I mean, you're very welcome. It's certainly what we love what we do as nurses. We need to care for people. This year, 2020 is the World Health Organization's Year of the Nurse and the Midwife. I'm not sure this is quite what they had in mind, but it certainly brought all of us together as a global community. And we're very happy to be in a position where we can really help people all over the world.
So excellent. So thank you very much once again, and let's jump into our topic. And before jumping to our topic, I would like to learn more about Learn, Share, Care. It seems such an interesting, intuitive, and very it's not very complex idea. It's very it's really easy stuff. But I'm surprised why it haven't been implemented yet. So can you tell us about more of your mission, what you're doing with that initiative, how you're devoting your time toward that? I understand that right now probably the 150% of your energy and your time is devoted to fight against the coronavirus, but in general, can you tell us a little bit more of the mission of Learn, Share, Care and its vision?
Yeah, absolutely. So Learn, Share, Care came about. I've been fortunate enough to work in many countries around the world. And what I noticed was that nurses are very driven as a profession to provide the best care for their patients, but they're not always in a position to have the opportunity to learn more as they go through their training. And despite the fact that there is a real thirst for knowledge. And so what I was finding was that a lot of charitable work is being done to try and promote education in low and middle income countries in particular. But actually, the delivery of education had some flaws. So some places are flying out professionals like me to go and deliver education. But I can only teach maybe 15 to 20 people at a time, in a country that's sometimes huge. And it's very difficult to evaluate the impact that that education actually has in country when you can only deliver maybe one course or one class. But I was finding that a lot of people were using their mobile phones to look at YouTube, on Facebook, and they're looking for information. But actually, there wasn't a lot of really good quality information out there. And the problem with YouTube, it's a fantastic resource. But of course, anybody can post anything at all. And it's not always regulated, and it's not always following best practice guidelines. And the problem is that as a UK nurse, if I go out to deliver education in another country, I'm delivering it from a very UK perspective. And that doesn't always chime with actually what the country needs. Similarly, I could have a colleague maybe from Australia or the US or Canada, and they will deliver the same education, but from the perspective of their own country. And that becomes very confusing for the end learner, because they're being taught many different ways, sometimes of doing the same thing. We actually do have international guidelines for so much care. They come from the World Health Organization, they come from the International Council of Nurses. And so Learn, Share, Care aims to utilize those global guidelines in order to provide useful education. But more than that, what I was seeing is that when we're delivering education overseas, we're not always taking into account the cultural differences in the way that education is received and the way that people engage with learning. And so my special interest in education is on intercultural education. So how can we translate what I do here in the UK into a country that has a very different culture to my own, and therefore make it a much more engaging environment? So there has been maybe a misconception that many countries around the world don't have mobile phone access or don't have 3G or 4G. We actually know that that's not the case. So many countries around the world, they have all of those things. And if we tap into that, then actually what we can provide is so much bigger and so much more vast. And what that means is that people from many different countries can actually come together and learn, and we can share our knowledge. And that improves care for people all over the world. The other thing that Learn, Share, Care does is provide advice and kind of consultancy work with charities. So charities that are hoping to implement education overseas, and maybe they need some perspective on how they can deliver it in a culturally sensitive way, or how it can be adapted for the country that they're trying to deliver. But further than that, how can it be evaluated? How can we measure the impact that we're having? Because it's so important to know that what we're doing is useful and having impact where it's meant to be. So this is what Learn, Share, Care does. And we believe that nurses and midwives all over the world should all have access to good quality education, no matter where they live, no matter how much money they have, or whatever the political situation might be in their own country. And that's what we try to do.
Well, basically, I have to say this is really a really interesting concept, and taking into consideration a few facts. First of all, what you're doing is really amazing. And second of all, we are all human, right? Yeah, definitely there is a little discrepancy, little differences, but anatomy is pretty much same. It's similar. And if I get flu, the flu is, what I'm trying to say is here, if you take care of me, you can take care of anyone else. So it's kind of transcendent. This knowledge and this practice of nursing is transcendent, right? Then yes. The second of all, the education is primarily goal. You're so right. It's for somebody, it's a privilege, right? And you are very right when you're saying that you can only impact if you are traveling, depending on how much time you have to devote, how much time and resources you have to devote. And you can teach what, like 30, 50 people, maybe 100 at most capacity, but how much one person can teach. And this analog way of teaching, the conventional, traditional way of teaching is so outdated. And you're very right. This mobile device, being mobile, right now you can buy a mobile phone for $50, less than $50. Absolutely. And it will be fine. It will be absolutely fine. It's enough because anyways, everybody is sitting on Instagram and like learning something which may not save lives. But if you devote to that, definitely this can be a powerful online learning tool. So online will reach to many people. And what you're doing, especially since you are talking about emerging markets, you are talking about developing countries, we understand and we know that teaching capacity is not at that level. You can definitely give a lesson with its NHS. It's like one of the best in the world, right? And you have one of the best schools, medical schools in the world, but not every country in the world has such privilege. So you are democratizing this education. It's incredible. So, and I think it is even more interesting and necessary in a giving circumstances of nowadays, where you have to learn distantly, we have to learn online because of the social distancing, isn't it? So maybe
Absolutely.
This is like a pivotal moment for your startup to go up in the air so people will realize it. So if we come back to the topic, I've been told that your topic will be the challenges from nursing perspective around the cultural differences in application of the best practices of the clinical environment, as well as the public health perspective, in order to slow the spread of coronavirus. So
Absolutely.
if you can tell us, break it down, please.
Yeah, of course. So I thought that I'd start by talking about the impact on nursing generally, and this is across the globe. There are some similarities, some commonalities, and some differences that we can see. So some of the similarities involve necessary upskilling. What we mean by that is taking nurses that maybe normally work in the community, maybe they're working in outpatient environments, so maybe the less acute areas, but actually where they're really needed right now is in these critical care environments, caring for our sickest patients, because our capacity is increasing all the time. And we're seeing that globally. And what that means is that we have a real need to upskill these nurses very, very quickly. So these are skills around managing airways, managing breathing, ventilation, things like that. They're specialist skills, actually, that people take years to learn. And we're having to upskill very quickly. What that means is that we're taking people out of their comfort zone. It's creating a lot of anxiety in the nursing profession because people are having to work in areas that they're not familiar with. And they're not having the time to integrate in the way that they normally would. So it's a very difficult time for nursing generally at the moment, having to step into new roles in order to help combat this. Fatigue is becoming a real issue as well. So fatigue across the board. Nurses already work very long hours, often 12-hour shifts. But we're throwing into that now, you're working 12 hours in an environment where you're wearing an awful lot of body protection, gowns, gloves, masks, visors. It's very hot. It's difficult to sort of understand.
For that note, I wanted to say that I saw, I think it is viral right now on social network. You see the nurses around the world showing their photo like after they take off the gloves. You can see it's almost like a scars, and you can see that. Yeah. And there was another video when a person showed a full time in a fast forward of how he's getting all the masks necessary, like there is 2 masks, and they're like people will have problems just staying in that, not working, but just staying, but you're doing constantly running and here and there.
Absolutely.
I think it's a total nightmare what's going on there.
Yeah, it's really, really tough. And not only that, it takes a long time to put it on. You have to do it in pairs. It takes a long time to take it off, and you have to do it in pairs. So the working environment, as well as it just being long days, with very sick patients in a high-pressured environment. On top of that, you have all this equipment. It's very hot. It's very stuffy. Like you say, it's leaving marks on people's faces. And it takes a long time to get on and off. So although we're taking regular breaks, we can't just pop off for a quick glass of water. It doesn't work like that, because to take all the equipment off takes so much time, and then to put it all back on again. Yeah. So fatigue is real.
And you cannot just like recklessly take it off. You have to be very cautious and put it in a way.
Absolutely. Okay. Absolutely, yeah. So that's across the globe. All nurses are going to be experiencing this. And here in the UK, we're very lucky. We have a very temperate climate, but I can imagine in places where it's incredibly hot and maybe there's no air conditioning, it's going to be really, really challenging to work in that kind of environment. So that's definitely going to be a problem. And the other problem, which I think has been touched on in the news recently, is around the danger of being a nurse at the moment. And I can definitely relate to that. So, nurses are providing huge amounts of bedside care alongside our medical colleagues. And so nurses are very at risk of contracting coronavirus and going on to have COVID-19. I myself have had symptoms over the last few days. I was tested yesterday. I don't yet know whether it's positive or negative, but certainly very convincing symptoms: fever, cough, breathlessness. And my nursing colleagues are going to be the same. We are, just by sheer numbers of people that we're having contact with, we are way more at risk of contracting the virus. So being a nurse at the moment is, even with the correct personal protective equipment, just traveling to and from work is putting us at risk. So nursing is a challenging profession to be in at the moment. But, you know, I can say my colleagues, you know, working so incredibly hard, and we're so very passionate about what we do, but it's certainly a challenge. And that's, as I say, that knows no cultural bounds. Those challenges exist wherever in the world you live. But what we do have are some specific barriers for implementing best practice in different places. So if we kind of look at, we can look at those in two ways. So we can think about the kind of practical logistical challenges, but also the cultural challenges that exist in different places. So from a practical perspective, it's a numbers game. So if we think about the UK, we have, according to the latest figures from the World Health Organization, we have 81 nurses, thereabouts, per 10,000 population. It's not bad going, but we still have to train up thousands more to deal with this pandemic. We're bringing nurses out of retirement. Our third-year students are coming to work on the front line. Our international nurses who haven't yet passed their exams are being given temporary registration in order to fill those gaps. So we're in not a bad position, but it's still a real struggle. Let's compare that with somewhere like Nigeria, which at the last count had just 11 nurses per 10,000 population, or India, who has at the last count just 17 nurses per 10,000. And you can see, just from a purely numerical perspective, that these nurses are going to be put under a huge amount of strain, just owing to the fact that their workforces have huge gaps in them already and are now going to be facing this enormous pandemic.
And you cannot just put, especially in such a tough time, you cannot just put, first grade university students back in there, because it is very important that they know exactly what to do and how to do, right? So you cannot just simply get the volunteers, give them the gear, and they can take care of it, since it's so contagious. Right. And you are very rare. I think people have to appreciate that people who are choosing this work, people who are choosing to become nurses, it's not high-end job, right? They're choosing it because of the dedication. I know it from my personal experience. Like, my grandma used to be a nurse for her whole life, and those people do not choose it for a glam. Those people, they don't choose it to work because it is, in any sort fashionable. Things get ugly, and if anything happens, you are in the front of it. So I think it's very incredibly challenging times right now.
It sure is. And actually, on that note, pay is definitely another logistical challenge. So in many countries around the world, I mean, pretty much everywhere, nurses are not paid huge amounts of money. That's the same in the UK. As it is.
I'm sorry. I know it's a not right question to ask, and in certain cultures it isn't, but in my culture it's fine. So I'll go ahead and answer. Did it change the paycheck amount? It's the same?
It's the same.
Do they pay for overtime, or it?
Yes, but not a huge amount. So there is talk in the UK about offering some kind of financial reward to the people that have worked through the pandemic, but we don't have any details on that yet.
It just talks yet. It's not on the paper. We haven't.
At the moment, yeah. I mean, and I'm sure you've had speakers talking about the impact on the economy. So who knows what kind of money we're going to have to actually make that a reality.
Maybe just a gratitude paper saying thank you very much for your.
I owe you. Yeah. Maybe something like this. But in many countries in the world, nurses are already working without pay because their governments are claiming that they can't afford to pay them. So they're actually back paying them and they're paying them in lieu. Their payments are coming in late. But they also don't have sick leave cover. So as I've already mentioned, these nurses are going to be very high risk for contracting COVID-19, but they're not going to have sick pay. So, whereas in this country, I'm fortunate enough that as soon as I have symptoms, I go off work. I don't go to work. It's for the safety of my colleagues. It's for the safety of my patients. But in many countries, that's not always going to be an option for people. So how is that going to be managed? And we don't have any answers on that just yet. So that's another logistical challenge of managing this in other countries.
And maybe it's just a good example just to see how polarized the world is. If you're saying that in UK it didn't reflect on your salaries, maybe this example will be a good in my country, because Uzbekistan, as a matter of fact, increased the salary of the people who are combating against that, and the salaries almost double folded for the doctors as well as the nurses. Yeah,
that's even really good.
Yeah, I'm not saying that the nurses in UK and nurses in Uzbekistan getting same amount money, but again, it's a different countries, different economies. So a lot of people were, and another fact was that we don't have that severe case yet. We don't have it. We have around like 700 cases and maybe 4 mortalities. I haven't checked the latest numbers. Hopefully we're flattening the curve at that case, but even though we were like voluntarily asked the doctors who want to participate in fight, because we had at the moment, luckily we have a surplus of medical personnel, and a lot of people were like saying that I want to go, and those who are going, their salaries were increased. So maybe this is something that world can and should learn, because well, you cannot train a nurse and you cannot have a doctor in 6 months. We know that this is the profession when people are educated in decades. So we have to really take care, and I think I have to urge many other countries to take care of their personnel, not only the way of saying the gratitudes, but financially or other ways to reward them, because this work is actually should be rewarded.
Yeah, I completely agree. And I think that, especially in countries where, potentially the risk of contracting it is higher because of other factors like fragile health infrastructures. Maybe another one of the points I was going to make is around lack of resources. We already have a global shortage of personal protective equipment, PPE. It's been in the headlines. Many countries have struggled, including the UK. And some of the countries that we're seeing of low and more middle incomes are actually only just joining the coronavirus pandemic. They're only sort of just starting to see their first cases and their first deaths. So actually they're still a long way off from having the kind of numbers of people that we're seeing here in the UK. And there's already a shortage. What is going to happen when they eventually hit their peaks? Is there going to be enough equipment? I don't have the answer to that, but it's certainly something that I think should have more attention paid, because how are we going to protect our workforce? It's incredibly important, sure. We've also got issues around access to healthcare. In some countries where there's very rural populations, people sometimes won't access healthcare for their entire lifespan. Sometimes it's just physically not possible to get to a healthcare setting. Sometimes those hospitals are already overwhelmed and just aren't able to. And sometimes it's a money issue. People aren't able to pay for their healthcare because they don't have healthcare systems that support people who have very, very low income. If you take Africa as an example, as a continent, 1/3 of the whole continent live below the poverty line. And that's going to have a real impact from a logistical perspective on how those people are able to access healthcare. Yeah. The final point I wanted to make is around the general health of the population. So here in the UK, and I know that similar stories in a lot of Western countries, what we're seeing is that the pattern of the disease is that it's having far less impact on younger people than it is on older people. And we don't at the moment know exactly why that is. But what we do know is that people with underlying health conditions are more at risk of contracting the virus in a very serious way than those who have underlying very healthy bodies. Now, if we take the sort of health of some of our low and middle income countries, we can see that there's still a lot of ill health in childhood as well as chronic diseases such as HIV and TB, which are underlying health conditions. And at the moment, we don't have a real sense of how those underlying conditions are going to impact on the spread of the disease, and on kind of mortality rates and things like that. So this is another thing that we need to consider, is that there is an assumption that this is not going to affect children or young people, but actually in countries where there are underlying health conditions, this could be a very different kind of disease pattern.
So basically, thank you very much. Thank you very much for all the remarks. I think you kind of, what you've said is universally acceptable and it's universally understood. And what you're doing is incredibly, it's really good. I think a lot of people should get on board and should partner you up. And we will definitely link down below everything related to learn, share, care. If you want to be in any degree and at any capacity you would like to talk, you can reach out to those guys, and they definitely need a help. So Rhiannon, if we're gonna make a stop at what you do with the platform, do you have your MVP? Is it up and running? How people can apply? If we can explain the process. And
yeah, absolutely. My contact details are available on the website, and people can email me directly if it's something that they think would be helpful. But what I am trying to do at the moment, I appreciate that money is very, very sparse in a lot of places because of this pandemic. So I'm making short videos and putting them on my Instagram page that people can actually look at, looking at infection prevention control, hand washing, using masks appropriately. And I will continue to do that so that people can access. If there are charities that are hoping to implement their own education, as I said, my specialist area is in intercultural education and translating that from our UK-based background into other countries. And again, my email address is on the website and people are able to contact me that way.
Okay, excellent. So, and I assume that you're going to resume your work more on the platform and making it learning management platform, sort of like edX for nurses, after you have after you win the combat against coronavirus. And meanwhile, we will link down below your Instagram account. And I think you're doing great work. It is a platform. It is working already. People are using it for very different reasons, and why not to use it for learning and teaching. So we'll definitely link down below so you can see the tips from Rhiannon, and we will, I think we're going to see your progress with your startup in the near future. I think we had an amazing talk, and we can go more and more, but I'd like you to focus on your health, because I assume, regardless of your situation, if it's fingers crossed, if it's not COVID-19, I know that you will just, without finishing your, without recovering, you'll just run back to your hospital, and people's health come first, and this is, I can see in you. So I want you to go with a message. What would be your message to people, to government, or generally what you want to say at the moment as a conclusion of our interview?
I think the message that I would like to say to governments all over the world is not to forget countries that have not yet seen peaks in their pandemic, and that I hope that we can support other countries in the way that we have been supported, and not leave anybody behind. And I hope that this brings the globe closer together, and certainly in nursing, it brings us closer as a family for this and going forwards, I think.
Thank you, Rhiannon. Thank you very much. I again wish you the fastest recovery possible.
Thank you.
Prayers goes to you, and I really hope you can continue your force. What you do is really amazing and really important. It doesn't matter what you do as long as you keep doing it. I hope your company and your vision will go out there. And once again, we're going to link down below everything. And it is interesting times. And thank you very much for your time.
Thank you so much.
And for others, please see our other videos. They're going to be way more experts from different fields talking about the effect of the coronavirus, and you can see it on our website. Rhiannon, thank you very much for time being.
Thank you.
talk to you in a good day. Thank you.
Thanks. Bye.